finished here on both sides, and I am on the second page, this one. Now, if you're missing something, I'll give you. Any papers you're missing, I'll give you. All right, when caring for a patient, underline the word NG2. I was telling you, you apply a water-soluble lubricant. Everyone remember, when you're putting NG tube or G tube or Foley catheter or suction, you have to lubricate. Very important for suction, NG tube, what do you use? What kind of lubricant? Water-soluble lubricant. Are we clear? You don't take, there is oil-based. Oil-based is not good. So what do you need a lubricant? Water-soluble. Why? Why do you lubricate? Underline the word to prevent soreness. It's hard. The tube is hard and it's going to rub hard. So I started the next page. And so remember, water-soluble lubricant for your suction and for NG2. Let's move on this page. You finish one and then you go on this page. Second line, gastric lavage. What is lavage means? Is irrigation, washing. Gavage means is feeding. When they say patient is taking gastric gavage, you are feeding. Lavage means you are washing. When? Underline the word ingested substance. Second line, poison. You have taken a lot of medication to poison. So what do you do? First thing, wash out the stomach. And what do you do for lavage? And in poisoning, write down the word. When it says ingested word, poisoning. Your patient swallowed a lot of poison tablet. What do you do? Empty the stomach. And how do you do that? Quickly they put the tube and they wash it out. And they clean the stomach. What is the word is called lavage. Next is in documentation, underline the word dressing. Question on dressing. When you're changing a dressing, what you should document. In the end of the line, size. What size of your wound? Color. What color you have. And also what type of the drainage you have. Consistency and of the drainage. So whatever the fluid is coming out, what is the consistency of the drainage we have? So everyone, you are changing a dressing. You are a nurse. And what are you looking in your documentation? Number one is your amount of drainage, color. So you're looking the wound drainage, but also you are going to monitor the size of the wound. What size? Depth of the wound. You got to monitor depth of the wound, the size, and the wound drainage. What are you looking in wound drainage? Color. Now, it is very important. Not you think now we don't need to. Yes, you go to work and you have a patient who's having a wound care. You did not write the size and this and color. You have pus here, yellow color. What does that mean? There's infection, right? There's a bleeding here. That means they're bleeding inside the wound. That's not good. You got to know what drainage do you have. Now, if you have this problem, and how do you monitor? Underline the word mm, 10 mm, millimeter, like this, mm. So your is mm. Your measurement is of the wound is in mm. Are we clear? Millimeter. Next is noted on the dressing. You document. Next line. You will go if your Babinski reflex is positive. And where do you check Babinski reflex? On the foot and the sole of the foot. And also with the sharp object. Second line. The next line you go positive Babinski reflex shown. How does the foot will do? Dorsiflexion of the great toe and fanning out of the other toes. That is your Babinski reflex. I want you to write down Babinski reflex disappear in 1 year of age. Write down on the side. So in your PEDS question, this is the reflex disappear the latest by 1 year. Now write down on the side, if it is positive in your question, patient fell and patient Babinski reflex is positive, what does it mean? Write down ICP. That is one of the signs for ICP. What is ICP? Write down the word brain injury. What are you assessing? Neurological assessment. Now the wording can change it. They might say, what are you assessing when patient positive Babinski reflex? You might say ICP. You might say in your question, assess neurological. What is ICP? You are assessing neurological. What are you assessing in ICP? Level of consciousness, vital sign, and write down pupil reaction. You guys have done in neuro problem. Are we clear? So what is your ICP is neurological problem. What are you assessing in neurological problem? Level of consciousness, vital sign, pupil reaction with the light, right? We use the PERLA word. You guys have learned PERLA. And what is the vital sign happen in ICP patients? Blood pressure goes up, pulse is down, and respiration is low. So side by side, you memorize your ICP. So everyone remember, Babinski reflex is positive, means your patient has problem neurological. Are we clear? Maybe you are assessing ICP. Next is bladder distension. Where do you check bladder distension? Underline the word lower abdomen. Our bladder is right here, above the symphysis pubis. This area is symphysis pubis, above. So when you're looking bladder, you assess where lower abdomen, above the symphysis pubis. So underline that word. What is bladder distension means? Patient is not able to pee, and write down the word urinary retention. That means your patient is retaining urinary retention, the urine. Next is, I'm going to go over, is pressure ulcer question. What is a pressure ulcer? Patient are bedridden. Underline the word bedridden. If they're saying patient stays in a bed and patient has a redness, or how do you prevent skin problem? Turning every 2 hours. What are you doing? Turning. So remember the word bedridden. What is the meaning bedridden? And is immobile patient. Word, immobile. Patient cannot move. Which patient are you going to turn? Those who cannot turn themselves. Are we clear? Which patient are you going to turn who is bedridden and immobile? And you turn. But if your question is, your patient is wheelchair bound, and patient is going in a workshop every day, and patient has a redness. Now don't put them in the bed and turn them. Why? They're wheelchair bound and they're going out. Now what do? Teach them change position in the wheelchair. Turning, shifting. So turning in the wheelchair or moving. Then your answer will be totally wrong. Put them in the bed. Are we clear? Why? It's only redness. It's not a big open area. But even you're sitting in a chair, you shift the position. That helps them to, if you sit too long in one, you get sore. So even you're sitting, just shift, move. And you're going in the bathroom, you're getting out of the wheelchair. That will help. But do not pick up answer to put them in a wheelchair. Which are in the bed would be good, turning. I want you add there for your skin problem patient. Which are the patient can get bed sore or skin breakdown? Now we said turning is good. Very important, malnutrition. Your patient who is not eating, they are very high risk for skin breakdown. Even you are turning, but they're not. So they're saying risk for patient for decubitus. Remember, which your patient are risk for decubitus? Number 1, malnutrition. That's your answer. Number 2, yes, if they are immobile, you turn them. Number 3, keep them dry. Are we clear? And also avoid sharing. What is sharing word? Is rubbing of the skin. If they're sitting in a wheelchair, what happened? They're going down like this. And what happened? They're rubbing. And even you are turning roughly, you are sharing the skin. So remember the word sharing, turning, keeping them dry. And very first answer, malnutrition. Which patient are you going to turn in your question who are bedridden and those who are in bed and they cannot turn themselves. But if they're wheelchair-bound patient, you can also help them turning. So not only turning is you can do in the bed, but also shifting the position in the wheelchair. Is the wording of your question. Not only they're looking one skin, a patient who's going in a daycare program all day, you don't want to stop them going daycare. That's their mental and their job, they're going out. You don't want to put them in bed. Now I will keep on moving. Next line, anti-embolic stocking. Which patient? Underline the word thrombos, write down DVT. Anti-embolic stocking. What are the other things you will prevent them from DVT? What are the other things you will do in your patients for DVT question? Anti-embolic stocking. Number 2, SCD. You put them on their feet. Is called sequential compressive devices. And also ambulation. You can prevent your patient ambulation, SCD, anti-embolic stocking. Foot exercise. Teach them to do exercise in the bed. Dorsiflexion. Dorsiflexion. Very good. Dorsiflexion. What does positive dorsiflexion mean? Our pain on dorsiflexion means positive patient is starting your DVT. Are we clear? So everyone knows on that. I will move on. So see, is knowing wording very important, one thing, and also you know this. Where do you do next line? Adult convenient vein, underline venopuncture. What is venopuncture when you're taking a blood? Venopuncture. You're puncturing the venous and drawing the blood. What is the best side? R. Underline the word basalic and cubital vein in antecubital. This is your antecubital area. Are we clear? And what vein are you looking? Basalic and medial cubital vein. So where are they taking the blood? Or IV, this is good side. Are we clear? Venopuncture side. Next is, we all should know, 2 to 3 hours tube feeding. The nurse should aspirate. Write down the word residual. Every 2 to 3 hours or every 4 hours or before feeding, you should check residual. Write down 100, continue feeding. More than 100, you stop feeding. 100 or more than 100 or above. If less than 100, you continue. Less than 100, continue. 100 or more than 100, you stop the feeding. Are we clear? And you're checking residual. Next is, you will go on, is O, blood. O, blood is donor. AB is recipient. So we all know. H, hertz is the measurement of sound. So underline hertz for sound measurement. Hearing protection is required when sound waves are exceed the strength. So you don't need to know that. That's okay. If you don't even know that, it's fine. But hearing prothrombin time is a clotting factor is produced in the liver. I'm doing this package. If you don't have, there is package you can pick up from here. And I'm on page number 2. And on that, prothrombin time is factor produce clotting factor in liver. If your patient is having menstruation, do you collect urine specimen? Yes. And write down the word, write it down, note on the lab slip. So okay to collect, but write down on the lab slip, patient is having periods. Are we clear? But it's okay to collect. Lumbar puncture. Which patient do we do lumbar puncture? Lumbar puncture for meningitis and fever. And you do not do lumbar puncture. Nurse noted intracranial pressure and the lumbar puncture, the nurse noted initial intracranial pressure and the color of the cerebral spinal fluid. Now I want you to write down there, lumbar puncture, and write down the word where it says intracranial pressure, contraindicated. What is contraindicated in NCLEX question? You cannot do this, lumbar puncture, if your patient has increasing ICP, because it can cause herniation of brain. herniation of brain. Contraindication is, you might take the package here. We have some extra package. So contraindication for ICP, and what patient, when you do not do lumbar puncture, if your patient is diagnosed with ICP. Are we clear? What position do you do after lumbar puncture? Supine. Write down the word supine after lumbar puncture. During lumbar puncture, what position? Fetal position. Write down the word fetal. During procedure. And you're bringing head close to the patient's knee. And after lumbar puncture, put them flat. To prevent is headache. And what will happen? They're leaking cerebral spinal fluid. Are we clear? That's lumbar puncture. And everyone should know the procedure. So lumbar puncture 1 comes in exam. Next is, if your patient cannot cough, provide a cough to provide. Patient can cough. Provide sputum sample for culture. Underline the word aerosol treatment. What is aerosol treatment? Breathing treatment. Write down the word bronchodilator. Now, I want you to write another simple word. If there is a question, see, these are your questions. You are a nurse, doctor has ordered your patient to collect a sputum specimen. Yes, so for sputum specimen, now here it says they cannot cough. But if your patient can cough, what do you teach them before you do collection of specimen? Cough. Expectorate word. Teach them expectorate. If you are getting spit word, that is from the mouth. Discard this one. So they say your patient spitted. And what do you do? Discard. Spitted means it's not a sputum. And what do you teach patient before you collect specimen? Teach them cough. Teach them to expectorate. Expectorate word coming from lung. But if you cannot cough, then you can give them is what is your treatment, and they say aerosol therapy. What does it do? Aerosol therapy, breathing treatment, and it loosen up the secretion. So write down, loosen up the secretion. Before you collect sputum specimen, increase fluid, because fluid is helping the phlegm to come out. Are we clear? So I don't know how your questions are worded. Maybe what do you teach your patient? Cough. What do you do before you collect specimen? Fluid. Maybe good. Patient who cannot cough, then you go aerosol therapy. Are we clear? And after sputum specimen came many times, after you collect, what do you do? After you collect? Mouth care. Very good. Mouth care. Now, there may be answer, send the specimen to the lab. That's fine. You do. But very important, what happens when you have lung problem and you're spitting from your mouth, you don't eat, and your appetite goes. And patient with a lung problem, they have a poor appetite, so your whole questions are, they're spitting, they're taking out the phlegm, their mouth is smell, and the appetite is poor. Very important as a nurse, give oral hygiene. Are we clear? So after you collect the specimen, I will move on. Underneath is eye ointment. Put first, then you put eye drop. So if you have two, you first put is eye ointment, eye drop must be installed. Eye drop first, then you go ointment, not ointment. Make sure eye drops right down first, then ointment. Isolation room. Everyone should know when you are leaving isolation, what do you remove first? What do you remove first? Gloves. What do you remove second? What do you remove second? Gown. What do you remove third? Mask. Mask should be last. Are we clear? So remember, everyone should know how to remove your gloves, how to remove your gown. It's coming in exam. How to do your mask. You got to untie from the back. Your hands are clean, and untie that and make sure this is the part inside is dirty. So you can touch more from outside is contamination, inside is contamination, and throw it away. And when you're taking out the gowns, you inside out. Are we clear? And gloves, you can remove the first gloves is you are removing, but with the glove hand, pull that out. Second hand, you can take inside and put the first glove and wrap it and throw it away. make sure you guys know. These are your questions. How does CNA is removing? How does LVN is removing gown? Next is skeletal traction. There are two kinds of traction. Skeletal tractions are, underline the word, they have pin, they have tongs. And what are you using for your skeletal traction patients are? Write down the one, sterile cleaning. In your question, use a sterile gloves to clean every day with normal saline. Maybe doctor has ordered medication to apply, but remember, in skeletal traction, what are you monitoring for? Infection. Where do you monitor infection? Write down pin site. So how do you prevent infection? Cleaning pin site. So first thing is you do cleaning. Sterile technique came in exam. What glove are you going to wear? A sterile glove. Are we clear? So they're saying patient has a skeletal traction. How do you clean them? By wearing a sterile glove and clean it. Are we clear? And what are you monitoring? Infection. If there is infection, then what do? You do culture and start antibiotic. They got to start antibiotic. Okay? Next is total parental nutrition. Where do you keep it? In the fridge. Where do you keep your NG tube feeding? In a room temperature. So make sure you know that. Before 30 to 60 minutes, you remove the solution. Are we clear? And don't give them cold. Keep it in the room temperature. Next is intramuscular injection. You give in the muscle and routinely injected intramuscular into tissue. You don't give in tissue. You're giving in muscle because they're not absorbing. What is your angle for IM injection? Write down 90 degree, your angle, your IM injection. Next is Committal Station. Your patient is non-responsive, comatose. What is the last thing you lose in Committal Station? Hearing. Are we clear? Now sometimes we think patient is not responding, they don't know, and we talk personal talks in the room. So remember, normal voice. When you are explaining, you must explain. Tell the patient, I'm going to turn you, I'm going to do. And also remember, hearing is the last thing we lose. So patient do hear, even they're not responding. Explain. Denture. How do you clean the denture? When you remove the denture, when you're washing, put the washcloth in the sink. Why? Because you can drop it and it can break. Are we clear? So that is, you guys have learned in oral hygiene. When do you remove dentures? In the night time, after dinner. Remove them, clean them, put them in the cup, and when you're washing them, put the in the sink to prevent them from breaking. EEG. Where do we do EEG? What is EEG? And what is ECG? This is cardiac. This is an electroencephalogram. So EEG, write down electroencephalogram. So where are you using electroencephalogram? For brain. This is you're using for heart. So they're doing electrical impulses, EEG. I want you to abnormal brain wave. It's electrical, like a cardiac, it shows in the cardiac ECG, it shows EEG for the brain. Very important, add there. Before your patient is going for EEG, no stimulant. No coffee, no stimulant drug, and no depressant drug. If your patient is taking seizure medication, you hold the medication. If your patient is taking sedation, you hold it. You got to hold the medication before your test. And for preparation for brain, wash the hair before and after. When they come back after, a lot of question, post EEG. Post means after. What do you do after? Wash the hair, because you have all that gel in the hair. And before you're going, you want to keep the hair clean and dry so they can use the electrical wave. So EEG is for the brain. when you're sending for EEG, don't give stimulant, don't give depressant, wash the hair, patient return back, wash the hair. What do you monitor? Because you are holding their seizure medication. And they didn't give you wash hair. They said, what would you monitor for your patient after patient come back? Number one, safety. They can fall. If they get a seizure, because you were not giving seizure medication, safety, and monitor neurological assessment. You monitor neurological. Are they getting alert, aware, and start their medication. As soon as they come back, go ahead and give the medication. Are we clear? So, see, you can get by only with one thing to remember. You should know a little bit more. Anyway, your question comes, you can apply the answer. So that is your EEG for a patient. And next is, I will go last one. Underline the word feces. Feces is stool specimen for ova and parasite. How do you collect the specimen? Underline the word deliver to the lab without refrigeration. Don't put in the fridge. Write down the word fresh and warm specimen. They need the fresh and the warm specimen. Are we clear? Ova and parasite, that's the only stool test you got to send immediately to the lab. Next page, we'll move on. 5 rights of the medication. We all know rights: right drug, right dose, right route, and right route and right time. Everyone remember, if the doctor has ordered a medication, and sometimes they give you the question with the drug. So you must know, is your drug. What drug? For example, I'm just giving example. Doctor has ordered Lasix. This is a drug. What is the strength? 40 milligram. What is the route? PO. Are we clear? And how is daily? Means once a day. If you didn't have PO, you're missing the route. Are we clear? If you didn't have this, that is your routine timing. So if doctor comes in 40 milligram daily, that's not your complete. They say, what is your complete answer here? They're missing what is route. What route is? Are you giving PO or IM or IV? Are we clear? Very important that you must know your drug when doctor comes and write the order. And they can throw these wording and they will say, how do you correct this? What are you missing here? And also remember, how many days? For 10 days or for 1 month. Is stop date. Sometimes they're looking for stop date. But that's very important that your drug should have right drug. What right drug are you giving? What is the right dosage? 40 milligram. What is the timing and the route? PO and timing, TID. Are we clear? This is your exactly correct way when you give medication. Next is evaluation question. Care plan, write down on the side. In care plan, and they're saying, they don't use the word care plan, they use the word plan of care. Plan of care is same as a care plan. And how do you, what is evaluation phase? Last is your evaluation. What are you evaluating in your patient? One answer, and underline in second line, met the goal, desired goal. What is your evaluation? Highlight the word second line. Your goal is desired goal. You want that patient to be, for example, your goal was patient free of infection. And what is your goal here? Evaluation. Your patient infection is gone. Your goal is met. So if they're saying, how do you assess your evaluation phase of plan of care, your answer would be, what is evaluation? Your goals are met. Are we clear? Your patient goals, and what are the goals you have in care plan? I wanted to write down short-term goals, and long-term goals. Short-term, maybe it gone in a 1 week. Long-term goals may be in 3 months. So there are goals there, and they're saying, what are the types of goals you have for your patient? In your care plan, you do short-term goals and long-term goals. So that's good in evaluation. Then I will move on. patient in sublingual and translingual, nitroglycerin is given for angina. We all know, right? How do you give anginal medication? Under the tongue. Are we clear? What do you monitor when you give anginal medication? What is anginal medication? Nitro, right? What do you check before you give nitroglycerin? Blood pressure. Very good. Blood pressure, because your blood pressure drops. What are the side effects of nitroglycerin? Hypertension and headache. So it's a repeat, we talked about it, but you got to be clear in your mind. You're checking blood pressure. Next is, so this is evaluation. Evaluation, you're checking goals. Now they're saying in your care plan, implementation. We have the word implementation. You plan and you apply and evaluate. What is implementation? You're applying what you want to do for your goal. Underline the word implementation phase. What do you monitor for implementation? Involve patient response to the care plan. And putting the nursing plan, underline the word action. What is implementation means are action. What action are you taking for your patient care plan in applying that care? Are we clear? So what is implementation is action. What was my plan? This patient will not develop bed sore. So what is my implementation? Turning. Are we going to turn? Acrylic mattress, yes. So what are we doing? Action. So what are you assessing in, so remember one wording. Attach that wording. What are you assessing in implementation? What are you going to do? If your care plan didn't work, what are you assessing? Who is not applying your care? Implementation. You didn't turn your patient, your care plan. So if your care plan didn't work, what do? Assess implementation. Are you doing that what you wrote it down or not? Are we clear? See how they're checking. They're not giving you to write a care plan, but they're checking your knowledge. How do you do your care plan? So what is implementation? Underline the word action. Delegating, coordinating word. You coordinate CNA to turn. You coordinate dietitian to bring protein diet. Are we clear? So what are we doing in implementation? Action. And what is in action you're doing? You delegate. You don't do everything by yourself. And coordinating. Remember I said, your patient care is very important coordination. You cannot do by yourself. You got to assign people to help you. Everyone is okay? What is implementation? You're looking action, you're looking coordination, you're making sure people are delegated to do the job. Are we clear? And what is important for implementation? I want you to write down communication. If you don't communicate, see, you got to have a critical thinking for this exam. If you don't tell CNA, you have to turn your patient. CNA is not aware. Is she going to turn the patient? No. Is your patient just going to heal? No. So what you didn't do, you did not communicate it, and who, your delegated person who is going to do it. So why are you going to write a good new care plan, beautiful care plan, and you're not following? Are we clear? See, what do? Very important, you guys write it, you go home and review, you will be better off learning your questions, okay? And so that covers your implementation. Next line, you will go when assessing your assessment, underline, you'll check patient history. What was patient previous history, current problem, beginning and the onset of problem, and continue. So what happened to the patient before and what is happening to the patient now and what's going on in assessment. Assessment is not all what you go and assess your patient. Assessment is checking your patient history. Problem, what problem is ongoing with your patient? Are we clear? That's your assessment, part of assessment. Never give false assurance. Never say you will be all right. Are you going to be okay? No, you don't give false. If you're not sure, don't anything you tell them. After receiving, underline the word pre-op medication. Make sure your consent is signed. Because once you give pre-op medication, your patient is sleeping. Before your patient signs, they should not be under influence of any medication. So that's about the consent. Next is lifting. Nurse use weight of the body instead of the strength of your thing. How do you lift your patient? Remember, keep your back straight. And what are you making here? The base of your body. And you are not twisting your back. Very important. You are using your muscles, are we clear? And your thigh muscles, abdomen muscle, but you're not twisting on your, so base of the back. Very important, your lifting, questions are coming in lifting and turning your patient's arm. Next is physician explain about operation. If patient has question, refer them to the physician. So in consent, patient did not sign consent, patient is not clear, you have them explain them. And doctor explain. When obtaining history, underline the word, obtaining means you're talking to the patient, from actually ill and agitated. Your patient is agitated, patient came very sick, and you want to talk to the patient, how you should talk, underline the word, limit your question. Don't talk whole history when they're very sick, you can talk to them later. Ask an important question. So your patient is getting agitated, you're talking, don't talk a lot of things, maybe few things, and limit your question. Don't keep on asking all the things. Drainage tube is broken. Immediately clamping the tube is okay, because why? You don't want the air to go in. Sudden use of, you shouldn't use thumb when you're checking pulse rate, because thumb has a pulse and it will confuse your patient pulse. So remember, when you're checking pulse, don't use thumb to check the pulse. You got to use the finger. Same thing for CNA. Intervene. CNA is using a thumb in checking a pulse. You intervene. They're checking your knowledge about checking the pulse. So one thing is, don't use the thumb, use the finger. Next is, what is one full respiration? Next line. Inspiration, breathing in. So when you breathe in and breathe out, that is your full count. Are we clear? Don't count breathe in, breathe out, one. You breathe in, breathe out is a one count, okay? That's our full one respiration. Eupenia, see, they're simple question, but when you're sitting, you cannot think, is that right? And when they have 3, 4 more answer, you get very confused. You got to have a exact knowledge. Eupenia means normal respiration. Blood pressure measurement, rest the arm against the surface, right down at the level of the heart. It's important, keep it at the level. Never cross the leg. Relax your patient, very important. Major unalterable. What is unalterable means? Non-modified, right? The unalterable, you cannot change. And write down the word non-modified. I did in the morning. Non-modified risks are for coronary artery are hereditary, sex and race and age. Can you change that? No. So what is the word they used here? Unalterable. You cannot alter. What is another word they will use? Write down the word non-modified. This is a medical terminology word, non-modified. You have in the books. And they can also say unalterable. But what is you can change for coronary artery disease and blood pressure? Weight, salt, right? Exercise, stress, you can cut down. Those are modified factor. Non-modified factor, you cannot change them. Inspection is frequently used in assessment. Everyone write down the word palpation. Came in exam. What is palpation? You are using your hand and you are feeling. And what are you feeling? Write down integumentary, the skin. In palpation, you are touching, and what are you touching? Write down the word integumentary, the skin. And what are you assessing in the skin? Tenderness. If you feel the skin is tender, warm, you are also looking, is a lump on the skin. Are we clear? But this is your tenderness, sign of infection. Peritonitis. What are you looking in peritonitis? You go here. If appendix rupture, it can cause infection and they lead to and so when you touch it, the abdomen is not soft, but they're tender. Are we clear? Palpation, Cayman exam. Your hand should be warm when you're doing inspection, palpation. Why? Because, and you press it. You press it. You don't go like this. You got to tenderness. How? By pressing it. Are we clear? And use your finger. Cayman exam, people could not answer this question. We think it's easy. But when you're sitting, these simple answers. So you got to, little bit, if you don't have a date and you want to look in your foundation book, it shows you how you do inspection, palpation, and all those assessment. But they are giving you very tricky question. Simple word, but people could not answer how to palpate. And you have to put in the order. Are we clear? So palpation. And also, I will go long-term, elderly person in a long-term care. When you are transferring, underline, transfer. What do? Personal item. When you are transferring, send all their personal item. Pictures in their room, photograph, chair, any belonging, clothing, TV, transfer them on your patient. If they're going in a hospital, whatever. What about your dentures? Make sure, glasses, watch, anything your patient has, transfer them with their clothing. Very important. We have big problem when your patient are transferring and you did not send their belonging and they get lost, then who has to pay for it? Us, facility. So it's very important when your patient comes in, everybody remember on admission, you do belonging list. That's called clothing list or belonging list. And you write down how many, they have dresses, how many this. They brought TV. Now don't write TV, but write down what brand, what kind of TV, how big you think the TV is. Are we clear? Now don't say, is a gold ring, diamond ring. Are you sure that's a gold and diamond? What do you write it here? Yellow, stone, white stone, whatever. But don't specify. People can claim it. Even they didn't have a diamond, they know you have documented, well, my mom lost diamond ring. Now you have to pay a lot of money, right? So if you didn't have it, and also when your patient is in nursing home, why do you want to keep diamond ring and if mom is confused? And she's going to remove it and she's going, you can tell them. I'll tell you, there are times when patient brought their wallet and the wallet has $600, $700 and family member didn't take it and nobody documented and somebody has stolen that money. And later on, they found out. I had a one-time family member, patient brought like $70, and they put it, it was the weekend, they put in the med room, and in their med cart, narcotic. Well, how many nurses are you changing? 3 nurses a day. And nobody was counting. And first, second, 2, 3 days they counted, they forgot about it. They never turned it back to the office to lock it up, their money. And when the family member is looking for the money, instead of $70, they left $10. $60 was disappear. Aren't you going to replace that $70 now to the patient? Yes. Very important, simple thing, but you have a legal responsibility of patient's belonging, even denture, even glasses, even anything. They're very expensive. And you're legally responsible. So when you're transferring, make sure you document everything, you transfer all your belongings with your patient. Next is, you will go on, is we finished that, is pulse alternate, underline the word regular and weak pulse, occurs with ventricular enlargement because stroke volume varies with each heartbeat. So if you have alternate weak, that means there's a problem, ventricular enlargement. Upper respiratory tract warms humidified inspired air, and also it helps them for taste, smell, and mastication, is chewing. Next is, this is important. When I say important, you must know. Accessory muscle. What is accessory muscle? Your muscle for breathing. and you are using, underline the word, intracostal muscle retraction. So what muscles you are using when you're having breathing problem, and they will throw in the exam. Your patient is having intracostal retraction, means is what they're using the muscle for breathing. Accessory muscle, and also sternocostoid muscle during respiration, and also at their nasal flaring. And I want you to write down sign of what? Respiratory distress. When your patient is having respiratory distress, they're not breathing normal. They are using their muscle to breathe. Intracostal muscle in the rib, sternum, intracostal right here. And what are they doing? They're breathing hard. So what are you looking for your patient? They will say, what are you monitoring your patient? Respiratory distress. In the baby, they're using nasal flaring, the nasals flaring. And they're using the, normally if you're breathing, we're not using the muscle, but when do you use this muscle? When you cannot breathe. Are we clear? So you got to do something for your patient. And what are you assessing? Very common question for NCLEX. Your patient is having sternal retraction, nasal flaring, and their muscles, they're using intracostal muscle, or they use accessory muscle. Accessory muscle are the extra muscles for the breathing. Underline that is good. Next is crutches. Axillary crutches. Their palms should bear the weight. When your patient is putting the weight, do not put where? Under the axilla. Where do they should put the weight? On their on the crutches. And why, I want you to underline the word, is when patient uses axillary crutches, their palm should use it. Why? To put the weight on. Remember, complications of crutches is, if your crutches are too tight, and they are having no space here, no space, there should be some space between the crutches. You are damaging, what are you damaging? The nerve is called brachial plexus. Write down the word brachial plexus. They are damaging axillary nerve and the muscle. So it shouldn't be tight. You should have a space between axilla and the crutches. How much? Write down 2 inches or 2 finger space. 1 to 2 finger space or 2 inches space. So it shouldn't be completely or shouldn't be tight. It should have a space. If too tight and you're resting your weight, you're damaging the nerve. So underline that word, that covers your crutches. Activity of daily living, write down the word ADLs. What is ADLs? Is simple cleaning, bathing, grooming, and write down the word is here, is rehab. In your question, what do you want normally? Your patient is able to do ADLs. They are sick, they cannot bathe, they cannot clean. So what is a normal thing when your patient is going in rehab, that your patient is going to do their ADLs? Are you clear? What is important? If I go home and I'm sick and I cannot eat, I cannot feed, I cannot change my clothes, I won't be able to live by myself. I will need help. You want the patient to be. So if they ask you what is rehabilitation, write down one, you make your patient independent. One word. Independent and are able to do their ADLs. Are we clear? So your patient is going home. Your question is changed. How do you know your patient is able to go home there and continue what? Rehab. What is rehab? You want them to go back and able to do their things. Simple thing of daily living are food, eating, brushing. Those are important. Next is normal gait. When we are walking, there are 2 phases. The first is patient foot rest on the ground and swing phase. So what are 2 phases are in normal gait? Gait means walking. When they use the word non-weight bearing, that means they cannot put the weight on the leg. Weight bearing means you're walking, putting a weight on your leg. Are we clear? What is ambulation increase? What is ambulation? If you're walking around and you're putting your weight, ambulation increases what? your calcium absorption. Are we clear? What is the word is called? Weight bearing. Ambulation, weight bearing, you're putting all your body weight on the bones. So what is it? Your calcium level is going to be good because your bones are absorbing. So in your question, how do you prevent patient from osteoporosis? Your answer would be weight bearing exercise, ambulation. Don't go range of motion. Range of motion is this. Putting a weight increases your calcium absorption. Cutting your smoking is your increasing calcium. Remember, these are simple answers, but those are in the exam. How do you increase your patient? Don't let them stay in a bed, ambulation. Which patient has more osteoporosis who don't walk? They're sitting in whole day and watching TV, not putting weight. People who walk around, they have a better calcium absorption. Are we clear? Okay, so I like to attach so you guys remember few things. So phases of ambulation is foot rest and swing phase. Mitosis word is phase of prophase, metaphase, anaphase, telophase. That's a division of cell. If you can remember, that's okay, but there is word. The nurse should standard in routine care of your patient. Standard precaution, gloves, gown, mask, hand washing. What part of the stethoscope you use to hear the sound? Underline the word bell. The round part is called bell. So bell is used to check your cardiac murmur, you're checking blood pressure, you're hearing the pulse. So what part of the blood pressure you use it is called the bell. So that's the last line. And I will move on. When you are looking in size, shape, and position is tenderness and assess reflexes. Now the next is blotment word. What is the word blotment? Where do you hear the blotment? Are we okay?
Pregnancies.
Your pages are matching with me?
Pregnancy.
Blotment. When do we hear the blotment?
Pregnancy.
In OB, assessment with the mother. What is a blotment? Underline the word bouncing of tissue against the hand. So examiner can feel the movement, bouncing of the baby. Are we clear? That is called blotment. Against the examiner finger. So they can feel. Even they go vaginal, they can feel the baby is bouncing back and forth. Are we clear? So underline the word bouncing of the against the hand. Hand is who? Examiner hand, right down there. Bouncing against the examiner hand. And this is your checking when the mother is pregnant. Blotment. Are we clear? Foot cradle word. Where do we use foot cradle? Write down on the burn. Write down when you, second line, vascular disease or neuropathy. And what is cradle is? It goes over the bed. It goes over the bed like a little metal frame. And your bed sheet covers that frame. Are we clear? So patient sheet is not going. If you have rheumatoid arthritis, what happens usually, you tuck the blanket and the sheet on the side and you put it over on the patient. But some patients, if they have poor circulation, they said vascular, neuropathy, and your patient rheumatoid arthritis and burn. You don't want the bed sheet to go directly on the skin. So what are you using? Cradle. They can throw the word, what would you use in a burn patient? Cradle. What do you use cradle to prevent the pressure of the linen directly on the skin? Are we clear? That's why we are using the cradle. Next is, and write down burn patient and rheumatoid arthritis, vascular lavage. Lavage is washing, drug overdose. Second line we already talked about. Irrigation, stomach washing out. During evaluation, in evaluation we said goal are met. Second answer, response to therapy. You are looking evaluation if you, after you give drugs. You are checking your patient, your drug is helping. What is evaluation? Not during evaluation step means if your plan is working, whether it's a drug, whether it's a care. Brute word is checking for which patient? Vascular. What is brute? You feel the pulsation. And where do you check? Dialysis patient. What do they have brute where? Shunt, right? So your feeling that brood is a circulation. OU means each eye, or both eyes, OU both eyes, and OD right eye, OS left eye for eye drops. If the doctor write OS, then you should know it's left eye, OD is right eye, OU means both eyes. Removing artificial eye. Patient has prosthesis eye. What do? Remove it, lower lid, and wash it with warm solution. Thready pulse, underline fine pulse. Axillary temperature is 1 degree lower. Always when you are taking axillary, you have to minus 1 degree. And write down rectal 1 degree higher. So if you are taking rectal temperature is 1 degree higher than your normal. Axillary 1 degree lower, this is higher. Are we clear? That's not an accurate temperature. So it is, you got to minus and plus in your temperature. Suctioning. What do you look in your sputum? Pneumonia question. Color, amount, consistency, odor of sputum. Write down the word sputum. If you suction, you're going to see what kind of color is coming. If your patient has pneumonia, and they're saying, what do you document? Patient is coughing, patient expectorate a sputum, but what are you looking in a sputum? The color. What kind of color your sputum is? What is the amount of the sputum? And what is the odor? You have a foul smelling odor. Are we clear? And you have green color. You have yellow color. That's a sign of infection. Are we clear? So, and I want you to write down when your patient is coughing and you are taking out phlegm. And they will say your patient has pneumonia, what do you document? You got to document is your cough. Your patient is coughing. Cough can be productive and cough can be non-productive. What is non-productive? No phlegm, no sputum. Here, the sputum. So when your patient is coughing, not necessarily some patients are taking out the phlegm. So when you document, you say patient is coughing, productive and non-productive. Are we clear? So that covers up on your productive and non-productive cough amount. PC means after. Underline the next line. AC means before. Bladder irrigation. I want you to remember, I did, and everyone remember, either you're listening Spider-Man and this packages, everyone should know you do continuous bladder irrigation. Write down the word. Irrigation means you're washing out. But continuous means you non-stop, the water is going in the bladder. Continuous bladder irrigation. Which patient? Write down the word third. Prostate enlargement, prostate surgery. What do you monitor with continuous bladder? Your bag, urine bag has a urine here. But what are you going to look? The color, amount. And write down when you're writing in INO, minus, if you have 600 here, you minus what irrigation solution you used it. Irrigation solution. You use 200 irrigant, minus 200. Your real urine is only 400. Question comes in exam. So everyone remember, when you're doing irrigation, whatever the water you're putting in to wash, you minus from the bag when you empty the bag. Are we clear? And which patient you're doing continuous irrigation? When they have is prostatectomy. They remove the prostate gland. It's called TUG. So irrigation means washing out. And they're saying, what do you monitor for irrigation for your patients is make sure you check the color. If it is a bright red, if it's clots, and the amount of the urine. Needle gauge is inside, diameter is smaller, the gauge, the larger the diameter, the number. If the smaller number, your gauge is the larger. Adult normally has how many permanent teeth? 32. After turning your patient was turned and finding, underline the word skin assessment. When you turn your patient, check the skin. Perla, Pupil equal, round, reactive to light and accommodation. They don't throw the word in exam like this. When you check the pupil, write down. If they are normal, is responding. Normal, when you bring the light, is responding with the light. And what happened? They constrict. That's normal. What is abnormal? Non-responding to the light. And they are dilated. They say your patient has a head injury and you bring the flashlight and you check. And what do you see? If they're dilated, they're not constricting. What does it mean? They're not responding. Now, they're saying in a word, what is PERLA? Pupil equal reaction to the light. But they don't throw this wording. They will throw your patient, you did. What do? We get the flashlight, we are checking, and they're saying they're dilated. And this one, when they're constricting and responding, that's normal. If they're dilated, that's abnormal. I'll be clear. So add those two wordings so you understand better. Percussion is for posture. What is percussion? Write down the word CPT. Chest physiotherapy. When you are doing chest physiotherapy, what are you doing? Like this, percussion. I'll be clear. So percussion is done in chest physiotherapy. And also, what would it be doing for your patient is nurse's hand should be cupped. Your hand should be like this when you're doing percussion. And make sure your patient is wearing gown. And what does it do, percussion? It loosens up the secretion. Before percussion, what do you do? Before percussion, write down the word bronchodilator. And let your patient drink fluids. Is helping them. Next thing, after you do CPT, write down the word postural drainage. These are nursing questions. And we all should know the percussion. Before you do percussion, you give bronchodilator because you're loosening up. And if your bronchioles are tight, your phlegm is not coming out. And what else do? You turn them in a different position to drain the sputum. So that would be good on percussion question. Next is bladder irrigation. We did already. Gauge, needle, PERLA. Okay, pulse we did. Blood, when you are monitoring your patient for rate and rhythm, pulse, very important, pulse. What do you assess in pulse? Your rate. How is your rate of the pulse, rhythm of the pulse, quality of the pulse, and the strength of the pulse. Wheelchair transfer. Make sure highlight. You got to know. If they give you, you're monitoring your pulse, what are you assessing? Rate, rhythm, quality, and strength. Wheelchair, you're moving your patient. What do? Lock the wheelchair and remove the foot rest. Between the wheelchair, remove it. Assessing respiration, same thing, rate, rhythm, depth, and quality for pulse and respiration. Subcutaneous injection, insulin, heparin. What is gauge? Came in exam, 25 gauge and 5/8 needle. When you are looking AA, awake, alert, O means orientation. What time they have, where they are, know the date and time. Write down orientation, neurological assessment. You're doing neurological assessment. Next line, gelatin, custard, ice cream, room temperature. All fluids by mouth include liquid at room temperature. And fluid administered feeding tube. And output, urine vomitus, drainage, NG tube, all you go in your INO. Intradermal. When do you do intradermal injection? For your TB test, allergy test, and how do you give intradermal? Last line is 15 degree. And what are you checking? Allergies. Now be clear, this is your allergy test for intradermal. And 15 degree is on there. Then next page, I will start here. Fruits are very high in fiber, but they're low in protein. So when you are low residual diet, you don't give fiber at the end. Underline the word low residual diet means cut down fiber. Next is pain. Second line, objective scale. Quality pain. Assess for your patient after surgery, your pain. Postpartum. Preparing for postpartum means dead person. You're going to assess. And what do you prepare your patient in postpartum? Cleaning your patient before family member comes in, viewing. Are we clear? They come to see. Do you remove all tubes when your patient is dying? Foley catheter, all the tube? Yes, remove all the tube. Positioning is important. Postpartum care, patient hand, your wristband is important. And remember, what do? They close the mouth here. Why? To get it tight. Put the dentures in the mouth. Otherwise, what happens? They become stiff. And put the dentures, keeping the jaw together. They can put either the roll or tie and put in a proper positioning. Are we clear? Postpartum coming in exam. Everyone should know what is in a postpartum. Prepare. And where is your transferring your patient? Funeral home. And sending, underline the word belonging. Don't send the wrong body to the wrong mortuary. I had this incident. The patient died, and they picked up, there were 2 patients in the room, and they picked up the wrong chart. Patient died, different name, they picked up the other lady's chart. And they called the doctor, the family, wrong patient, wrong mortuary. They sent the body to the wrong mortuary. I walked in the morning, and I usually come in the hallway, and I walk around and I see, oh, that bed looks empty, and I didn't see the patient. So I went to the nurse's station. I asked the nurse, everything is okay? She said, yeah, but Mabel died. Patient name was Mabel. But I said, I saw the Mabel in the room because she really didn't die. She was in bed. So I went back, before I would tell the nurse anything, I went back in the room and I saw that patient is there. So they picked up the Mabel chart, and Mabel is still living here, but the other patient died. And now I said, no, patient is still in the bed. So they sent the wrong patient, and they send in Mabel's mortuary. They call Mabel's doctor, and the patient's chart, the real one who died, wasn't done any documentation. So you did a wrong whole thing. I never learned what I'm going to do. And the nurse got very embarrassed, and she said, and she started shaking, what do I do? And my mind is thinking, what do I do next thing now? So I said, let's do one thing. Let's call the original doctor, and you call the other doctor. He was a Kaiser doctor. As I call him and let him know Mabel is still okay. She didn't die, because you called the doctor and you called the family. And imagine if you had she only had a friend, and she was about her age, and she said, oh, okay, so Mabel is all right. She was okay. Now we have to worry, calling this doctor, calling the mortuary. But what do? It's already in a different mortuary, the body is. So we have to call the mortuary, and we said, the body is not here in nursing home. The body has been picked up by wrong mortuary. So they have to go, and we have to call this mortuary to release the body. Now think about, if you called a wrong body and a wrong family member, they'll kill you. Yeah. And they'll get upset. But this friend was not really a family, and this patient family wasn't aware. So we called and we told them, she expired, doctor, no, we already transferred her in the mortuary, but we asked the other mortuary to go and pick up. I'll tell you, a lot of things can happen in one little thing. You don't be careful. Anytime your patient is going, the first thing you got to see, you have a wristband. Why would you pick up a child and you haven't checked the wristband? Even you work every night, they look all alike. You don't even know sometimes the difference. And sometimes you're not working regularly, you're coming after 3 days. You got to be sure you're doing the right thing. And I'll tell you, mistake can happen, but we've got to be careful to know your ID bands, looking into patient, what can happen. Are we clear? So it's important, and your questions are coming in postmortem care. Your doctor assign family member, choose the mortuary. You got to call them, make sure you send their glasses. What are they going to look for when they're doing? Is their glasses, the dentures, don't lose them. Next is, the nurse should provide honest answer with your question. Milk should not be included in clear liquid diet. I gave you a page with diet. Remember, make sure you guys know what is clear liquid diet. Child or confused patient, underline the word consisting in your teaching. What is consistency? Every day, same thing, because they don't remember. Very important, consistently teaching. Hypothalamus secreted, what is secreting? Vasopressin, oxytocin from where? Pituitary gland. Where is your pituitary gland? It's in the brain. What else your pituitary gland is producing? Write down the word growth hormones. And what else is producing? ADH. Are we clear? Write down there. Your endocrine. Three membrane of the brain, dura mater, pia mater, arachnoid. Those are the membrane. NG2, you are using to remove fluids or gas from small intestine pre and post-op care. Write down the word pre-op. Write down when do you do on pre-op? When you have intestinal obstruction. When your patient has obstruction in GI, you can put NG tube and you do suction. You're removing or before surgery. Are we clear? You can do that. Next is pre-op care and post-op care. You do that. Physical therapist and cryo practice, they cannot write prescription. Stoma word in your colostomy. How do you clean them? With soap and water. Vegetable, fruits and vegetables are high in fiber. So when you're giving low residual diet, don't give fiber. Patient TB test. How do you do TB test? Sub-Q. Less than ml. Not less than ml, I want you to write down 0.1 ml. Only one number. You're checking allergies. There was a nurse gave one whole full ml accidentally. And if patient is allergic, they can die. Are we clear? So it's when you're doing this test, you only give 0.1, not less than 1, but 0.1. Next is, I want you to go subcutaneously injection site, we already talked about, underline 25 gauge. Thin patient, you can go 25 to 27.5 inch. Bigger person, you can go 25. Giving drugs, checking ID band, very important, any procedure. Clean the skin before you give injection or your wound care. Next line, heparin goes in sub-Q, 90 degree and write down 45 degree. Both are correct. 45 degree for thin patient, 90 degree is well-built patient. You can go for sub-Q. Aspirate IM injection. If there is a blood, discard it. Don't give. If the blood, that means it's in the vein. So when you're giving IM, aspirate. If the blood is coming out, don't give that injection. Discard it. Patient hair. Do you cut your patient hair? Do you need a consent? Yes. I had one time patient hair was really bad and they were tangled. And the nurses cut their hair without even calling the family member. Do you think the family will get upset? Yeah. You got to get the consent. You got to let them know. Patient was confused. Do not ever do that. You do clean the hair, but do not cut your patient's hair. Remember another question. In nursing home, when you do hair done, people pay money for hair. Make sure you have a list of your beautician. Make sure you know when your patient has hair done. Somebody paid $30 or $35 to get the mom's hair. And morning, CNA washed the hair. They come and upset, I paid $35 yesterday, why the CNA has washed the hair of my mom? I mean, simple thing, but these are very important. I will finish this page, then we'll take a quickly break. And so very important, don't go for that. Next is injection. After you bleeding occurs, apply the pressure. Write down the word thrombocytopenia. Patient is risk for bleeding. Always apply the pressure. Why? They're going to bleed. There was a question on that. Patient has thrombocytopenia and thrombocytopenia after injection, what do? Apply pressure because they're going to bleed. The risk for bleeding. Scalp care, you can go, beginning the end of the hair and work towards the head. Now, hair care is okay. Very important on this page, hearing aid question. During insertion, remove regularly, clean it, prevent wax building, replace the batteries, hearing aid. And hearing aid, blue dot, left ear, red dot, right ear. Hearing aid should not be in heat, humidity, and do not immerse in the water. Should not instruct the patient avoid hairspray and hearing aid. And when do you remove hearing aid?
At night.
Nighttime. And if patient is hearing the noise, that means your batteries are not good. Always check the battery. Let's take a quick break. I have a few more pages and I'll be able to finish.